Welcome to the Six Hats podcast, where I, Dr. Shami, a lifestyle and nutritional medicine family doctor, will talk about how women strive to find balance each day by juggling their six roles, being a woman, mother, daughter, partner, business owner, and professional. Hello, everyone. Welcome back to the Six Hats podcast. Today, I'm with Dr. Fern White. She's the founding principal of Beacon Cove Dental here in Melbourne. Also, she's not only a dental surgeon, she's a yoga and embodiment teacher, keynote speaker, and mentor to hundreds of female dentists and doctors worldwide. Welcome, Fern.
Hi, Shami. How you doing?
Really well. Fern, I'm really excited about this conversation because dentistry and medicine all along has just been disconnected. It's almost right, go and see your dentist, take care of your oral health. We never put the two together. And so in today's conversation, we're actually going to look at holistic dentistry and why it's so important. And you're such a pioneer in this field. So I'm really, really excited. But I really want to start with your story. What led you to holistic dentistry?
Look, originally I was a migrant from Vietnam and I was a refugee and I was very young as a little boat person. And so we grew up in a migrant family with six of us. And it was quite funny because I was the allocated tooth remover for my brothers and sisters.
Oh, no.
At a very ripe age of like 12, only because I was doing it for myself because my dad had some pretty prehistoric ways of removing teeth, so to speak, floss and yanking and
Oh my God.
spoons
Wow.
and all sorts of things because we were so poor growing up. I just ended up doing it myself. And then he thought I was so good at it, he ordained me as the young family dentist at 12. But having said that, in my life, I've always been interested in other things, not just science and medicine. I wanted to heal people, but I was always doing a lot of self-work on myself. I loved yoga. I loved embodiment, learning about the body, but learning about the body through not just the physical body, but the emotional, spiritual body as well. When I got a chance to buy my practice at 28, 29, it was amazing because it was the first time I could bring everything that I'd learned together and not work for another, employer who perhaps dictated what I could do or not do. Yeah, so that was the start of it. And that's why I think in the end declined a lucrative partnership in another corporate practice to set out on my own. And I was quite young at the time. Yeah, and then from there, it was a huge journey for me. Also, lots of personal self-growth and development when I also encountered a lot of anxiety and panic attacks of having a business and being a clinician and wearing so many different hats. And I think, in the end, something had to change. And it really was on the end of a couple of massive breakdowns. Only my first year or so of owning clinical practice that I decided that I had to do a lot more self-work. So that really catapulted my personal development and growth as well. Yeah. And then I started to see similar things in my patients. Yeah. And I started thinking, how do we bring this all together? Because we're not just a body part. We're not just a mouth. We're not just teeth. We're a full spiritual, physical, mental, emotional body.
Amazing. And thanks for your vulnerability. I think it's really important to share current model of care, not only for doctors, but dentists. Actually, it's not sustainable. And just to give you a few stats, I think for doctors, about 40% of doctors go through burnout each year. I'm not sure about dentists, but I think it's very similar.
I think it's still on record the highest suicide rate amongst professionals. And there's a lot of things to do with that, but we work in very small, tight environments, the mouth, and we're trying to contort our bodies a lot. So we suffer a lot of chronic pain and we're perfectionists. So we try and work in tiny little body parts and we've got awake patients. We've got stressed out, highly strung, nervous, phobic patients with all of their energy. On top of that, sometimes we've also got to have a business and there's a lot of stressors that are going on. And it's crazy because then that kind of lends itself to this frenzy of practicing, seeing patients and churning them over. But then we burn out like I did very early on in my career, actually.
And did this spark the whole new way of how you do things differently now?
Absolutely. Yeah. I mean, I'd learned some amazing mentors very young. Like I was a very young dentist when I graduated. I was 22 years old. And I was thinking, how was I unleashed on the general population at that age now? But I had some great mentors as well along the way. And one of them taught me to spend more time with patients because before then it was seeing them 30 minutes in and out. And I could hardly remember their name. And I'd sometimes run 2 chairs before I bought my clinic. I burnt out so quickly, right? Physically, mentally, emotionally, I didn't even know my patients. And I could never do great work that I was proud of as well in that time. So I learnt earlier on And I was very lucky that the more time we spend with patients, the more, and especially having my own clinic, so I was able to spend the time now. Well, I had the pressure of making money in a different way, but I realized that I could also enjoy relationships with patients and get to know them and sit down with them and have a 60-minute initial consultation where we'd chat, we'd have a cup of tea. And yeah, it really transformed patients as well, and their fears and phobias, and being able to guide them from start to finish through this journey, renovating themselves, renovating them back to health and empowering them.
Already, you've just like transformed the whole approach to dentistry just by those few sentences. It's so true, because when you come in as a patient, we just look at the teeth, but you're actually looking at the whole person. Is that right?
Absolutely. So when we come into my practice, and it's evolved, and there's hopefully a few more dentists doing the same thing, but we take a lot of photography. So we've invested in, high resolution digital photography, and we tell the patient it's like this massive photo shoot at the start. That's how we take records. We need to educate them and help them see what's going on in their mouth. The gone are the days where, the dentist sits down and tells you what you have to have, and then you go, okay. And it seems like that every single time you come for a check and clean, right? There's something wrong. So we sit down and I just have a really laid back conversation in our office with a cup of organic tea, and we put it all there and we co-create together. And I give the patients all the options as if it were my mouth or your mouth, my sister's mouth. And they pick and choose what they're comfortable with. And here's the thing, it is expensive. I think I've only had 2 patients say, oh no, it wasn't as expensive as I thought, right? But it is going to be expensive. It's an investment in your health. But if you think about it in terms of the long term, if you do something properly right now, you avoid a lot of things that would blow up and be way more expensive and emergency and pain, inconvenient. Yeah, it's about the value that you put on your health. Whatever you seed now is going to pay huge dividends if it's done properly. In that process, we build trust. And I always say, like, this patient's mouth that I have in front of them, it's so beautiful because it often tells a story of their whole life, their fears, their phobia, is there crack lines, is there grounding, have they got sleep apnea, have they got deficiencies in their diet? You can see all of that. And then you see their smile. And that's a whole new ball game. Are they even able to smile? Like, I see some very tight-lipped smiles or grimaces. And some patients have not been able to smile for such a long time because they never thought that they could. They never thought it was an option. And they're so used to it that becomes their norm. It goes from like reestablishing health for them, right? First of all, and not just teeth health, but it has a huge correlation to every single part of the body. Reduce inflammation in the mouth, reduce inflammation in the whole body, which is the root cause of disease. And then on top of that, put the teeth back to where Mother Nature had intended, had it not been broken down, had it not been decayed and rotted away and inflamed. It's beautiful. You just set people up to where they naturally should have been, and you help them get support of their lips, cheek, tongue. And then they age gracefully. Everything's supported. And then they have this smile that is their smile.
I love how you say that, because when I think back to my experience going to the dentist, it's very quick. It's very right. Just check your health. Okay, fillings, no fillings, x-rays. It's so quick. And it's almost a bit traumatic because you're just fearful of, is there something wrong? Do I need to do something about it now? And yes, you're fearing the pain. But I'd love for you to mention about dental trauma. How important is that for us to, be aware?
Yeah, it's huge. So dental trauma, I would say in my patients, and our practice sees a lot of patients between the ages of 50 to 70, I would say. There was so many crazy stuff that happened back in the days where it was literally trauma. Kids were forced down, they were sort of suffocated, they had no control, they were worked on when there was still pain, they weren't numb, crazy stuff that would never ever happen anymore. The patients then still have this inner child trauma. And I get all walks of life. I have the CEO of the multi-billion-dollar companies coming in, and then suddenly, boom, you can see it. And trauma looks different in patients. Some of them are super defensive and closed and walled off. Other patients cry outright, and then others are just frozen. It's an opportunity in that first initial appointment to disarm all of it comes from fight or flight, right? So it's ability to just all of those habits and all of those little grooves that, boom, remind them of the trauma. So for instance, I always say sight, smell, sound. So in our practice, it's really important when they come in, it feels like you're coming into someone's home.
I love it. Love it.
Around, there's organic. It's like yours, Dr. Shami. When I walked into yours, I'm like, I love this. because it's disarming. Because as soon as otherwise trauma, just one little signal and then boom, the person's thrown back into a flashback. Yes. And then it's also building trust and helping the patient take back control and helping them understand that they can do this. And it's so, I have to say, out of everything, all the different things I've done in dentistry, building relationships with patients and helping them get back the trust that they can actually move through this thing that has plagued them for so long, which means if they can do it in dentistry in a few sessions, they've got this skill for life in all parts of trauma of their life, getting back their confidence.
The one thing that comes to mind, how many times I've had to give an answer while I've got my mouth open and they're cleaning it to say, right, Shami, we need to do this. And I'm going, oh my God.
We're so good at doing that language, right? Like the gargly language. But what we've also got to understand, and that's where I teach dentists as well. So my love is in coaching and mentoring dentists to feel themselves first, to heal themselves from all of these stresses that are going on so that then they can feel their patient. And so be acutely aware to, small things that the patients do, white knuckles that they see or a tension in the face. All of these things, like my practitioners are trained to just be acutely aware so that they can just stop, rest, come back into the body. Because, a lot of the time people are exhausted at the end of a dental appointment, and it's not because of the actual procedure hurting itself. It's because they're holding themselves in constant contraction.
True, they're tense.
And if you think about you tensing like that in bicep curls for like the whole hour appointment, you're screwed at the end of the day. It's exhausting. Yeah. So it's just small things like that. And then helping them visualize and see themselves as a different, like already done. So we talk about those sort of things a little bit at the start. And, for those who really get into it, we do a little bit of breath work and get them coming back out of the fight flight and into the rest, digest. I'm okay. And then we give them little signals at any point they've got full control.
Amazing.
So, yeah. And it's just
empowering. So empowering.
And it makes our work so much more fulfilled for us. Yeah, fulfilling.
Absolutely. What I love to do is move on to how oral health is actually connected to chronic disease. And to be honest, not many doctors even think about it unless, you can go down the integrative path. But even integrative doctors, yes, we're aware of it, but we don't put much emphasis on how it's so important, like how much, what you see in the mouth actually reflects the entire health history.
Inflammation in the mouth, like I think with the advent of COVID, everyone started to get a bit more aware about the mouth and things going in this area. I mean, the makeup of the mouth, we've got mucosa, we've got the gums, which is the first line of defense. Again, it's like the skin, it's your barrier, and it's the start of your gut, right? So we know all about gut health these days and leaky gut, but there's also like leaky gum. So if there's an overgrowth of bacteria, decay, periodontal disease, gingivitis in the form of because you've got the microbiome, which is filled with so many different bugs. Most are pretty good, but there are some bad bugs there. And it's always this fine balance, right? And so when the balance gets tipped, it comes in with nutrition, poor nutrition, or not looking after the teeth, or stress as well, and things start to overgrow in the mouth, then it starts to cause inflammation around the gums, for instance, which can then open up and spread to the rest of the body because the gums are connected to the blood vessels, which then can move through everywhere. And it can also move respiratorily when you cough up stuff as well. These are all connected. Blood-brain barrier as well. Everyone thinks it's separate. Your body is in this movement constantly. Lymphatics, everything moves through. So the bugs, there's this huge link now. Inflammation in the mouth, periodontal gingivitis, decay has a huge link to inflammation in the rest of the body because of these bugs. And often you can find some stats like someone who's got gum and bone disease, periodontal disease, is 2 times likely to have cardiovascular disease. And sometimes I think the stats on it is also things like Alzheimer's, and pretty much anything inflammatory in the body can be linked back to oral health now, which is fascinating.
That's incredible because, when we look at chronic disease, you spot on, it's actually all about inflammation, and inflammation presents in so many different ways. So you're absolutely right, because when we're thinking about even cardiac disease, inflammation of the vessels, all linked, to insulin resistance, not just about the few markers that we're familiar with, which is the cholesterol. And then you've got inflammation of the joints. It's all interconnected. It's quite phenomenal.
Yeah, it's the whole body. I mean, there's all these crazy studies that are coming out, which we intuitively know, because here's the thing, treating thousands and thousands of patients from start to finish, and because we've got such a thorough way to start from the bottom up first. So we always start from like, hey, let's just control disease, periodontal disease, the foundation, right? And then we start to build on top and make the teeth stronger. And that's always the philosophy we move through. And it's crazy to see case study after case study coming in. And we just see when you start to remove all of these, the inflammation in the mouth and get it back to health, that you can just see the health changes. The skin tightens, the eyes light up. And I wish I'd started, and I hope this is the new advent of functional dentistry, where we start to actually take bloods before and after and actually show, scientifically what we can see clinically anyway. It's amazing.
And when you look at holistic dentistry and you're looking at periodontal disease, how important is nutrition and lifestyle and stress management?
It's so crazy. It's all linked. We see when someone is highly strung and highly stressed, the gums become more fragile, they bleed more quickly. Then you've got hormones and all sorts of things like that. But also it tips the scale. The immune system gets bombed out with that cortisol overload. And then it starts to create, the microbiome gets out of balance as well. And then you throw in things like antibiotics constantly and mouth rinses and all of these things that have a lot of other baddies in them, so to speak, that doesn't nourish the microbiome. It just gets out of whack, and then you start to see inflammation soar.
That's amazing. You mentioned mouth rinses. I would love to know your thoughts about traditional mouth rinses. It's almost like yes or no. What do we do?
For me, it's like give the patient advice based on what I do. And I love biohacking. I love always thinking about, how do I have longevity of life, but have fulfillment of that life too. I've got a beautiful friend, Dr. Hisham in New Zealand, who created a wonderful line around mouth rinses, because I honestly feel there is so much pollutants and chemicals and things in a lot of the products these days. I know fluoride's a big debate on its own. I just think if you look at the mouth rinses like Listerine in the supermarket, you just see so many chemicals in there and alcohol that completely bombs out when you use it. It hurts because it is bombing out a lot of good bugs as well. And it's so funny because I think there's even a study recently done with chlorhexidine, constant use of a chlorhexidine type mouth rinse with all the chemicals in it started to produce more E. coli proliferation in the mouth in one study, which I just recently read, which is crazy, right? And it's because we're wiping out the good bugs as well, and they're not able to keep that homeostasis. Dr. Hisham, he invented this beautiful product. He created a beautiful alkaline mouth rinse, which has prebiotics in it, which feed the microbiome. So everything that you can do to help the good stuff in your mouth proliferate or in the body proliferate, allow the body to heal, because it has this intuitive sense to be able to heal when all the crap is literally taken away. Things like that. And I think also something like there's a probiotic range, active probiotics, which is amazing now to help with that as well, with periodontal disease, all of those things as well as an adjunct periodontal curettage that we do, so cleaning and scaling.
And you mentioned alkaline mouthwash, and I've heard this before, how important it is to check the pH for some holistic dentists. Why is that? Why is pH important?
It's the proliferation, it's the whole microbiome and bugs proliferating and the balance of them going off to more resistant gram anaerobic bacteria, which then can, survive in this hard environment and proliferate to create issues like periodontal disease and gingivitis. That's why we keep our mouth in a sort of this state. And I know these days you can do a lot of microbiome testing, which is really exciting to actually see all the species in there. But yeah, you've got to be careful as well, because you don't want your mouth to be in a too acidic state. Now, remember that bacteria use all of the sugars in your diet to then produce acid, which creates the start of tooth decay, right? So then you get erosion, tooth decay, all sorts of these things kicking in to if you have too much of the acidic environment. Yeah, that's why we move more into alkalinity.
Amazing, amazing. And you mentioned about antibiotics. So would you say, if someone is taking antibiotics for any infection, it actually affects the microbiome of the...
Yeah, absolutely. It's the gut. Does it affect the gut bacteria? For sure. Then it does the same to the mouth bacteria. Right. So, I'm not saying that don't take the antibiotics, take it where you need it. I've prescribed probably like a couple of handfuls of antibiotics in my time. I always want to treat the root cause, right? Unless it's something that really needs it, something systemic that can't be controlled locally. often if it's done properly, it's usually like an infection or that can be treated, curettage, drained, whatever it is. So you get to the root cause first and do it properly rather than taking it willy-nilly. And then often when I do have to prescribe antibiotics, say I'm doing implant surgery or something like that, we always try and prescribe probiotics alongside it and try and let the patient know what's going on. I don't know, in medicine, it's probably the same. It gets prescribed too much, wiping out good microbiome.
Absolutely. And you mentioned something really important earlier on, and it's the whole chewing, eating. And I have so many conversations with my patients about chewing, especially when they come with gut issues. And it's quite remarkable how many patients go, yeah, I actually eat really quickly. I actually don't have time to chew. And it's almost like a pattern or a habit that they've learned from childhood. So why is chewing so important?
Oh my goodness. Because I mean, just even looking at the ability, and I'm at fault at this too, by the way. So, but the ability to sit down and give ourselves a meal in peace, away from the laptop, away from things that's going to spike our cortisol and our adrenal levels. First of all, the fact that we can even look at our food, the mere act of looking at the food and even touching the food already starts the initial process of digestion with the secretion of all the enzymes that are required. Right? It's crazy. Our body's like this miracle. Its ability to do that. So that kickstart all of the saliva starting. And then as we eat and chew our food, obviously you're breaking it down. And the more you're able to break it down, the less you have to rely on the gut to do so. And especially if you're high stress and your gut acid is off kilter and it's not that high, you don't want it to ferment in there as well. So that starts that process, and it starts the breakdown, and then it starts, just a whole bunch of stuff, the pleasure of being able to taste your food and eat your food. And so it allows that nutrition to be there right from the start versus like fermenting in the stomach because you've just chowed it down. Yeah, so important. But yeah, I think there's sensory feedback from our fingers. So when we touch certain food, the body knows, it's a protein, it's a carbohydrate, and it starts to kick in that digestive enzyme already, in the saliva.
Amazing, amazing. Now, before we let you go, I would love for you to share, if it was one piece of advice you would give to our listeners who want to improve their oral health holistically, what would that be?
Yeah, you know what? I just go, take your time, ask questions, but listen to your gut feel when you find a practitioner. But then I think it's also like everyone is so scared of investing in their oral health, in their mouth, getting that beautiful smile that's going to give you all of the endorphins and the serotonin and the oxytocin that you need when you smile big. And so, yeah, I would just say invest in yourself and really ask the questions and find a practitioner who will spend the time to listen to you. But it's not just the pre-op care, it's the post-op care, because you're going to create a relationship long-term with this person. I've got colleagues out there, and yes, it's expensive, but I say it's like a little renovation on yourself, and you're worth it because it's your health. You've got this one body. It's your temple.
Absolutely. And do you know what? When you spend time, if you invest in prevention, wow, just remember the moment that you had pain with the tooth pain and it's horrendous. And there's so much you can do beforehand. No, I totally agree.
And I think just remember that in the mouth, it doesn't hurt until it's a huge problem. So you want to get in and just really screen for everything. Like we're doing a 100-point check on all sorts of parts of the teeth and the mouth. You really want to get that done thoroughly, because a lot of people have this myth that, it doesn't hurt, so I won't do anything. But when you do hurt, that kickstart the whole trauma pattern of dentists being too expensive, pain, all of those things. And remember, when you go and see someone and you're in pain, it's also harder to get you numb, right? Because you've got this the reaction to the adrenaline. The inflammation doesn't keep it in one spot. So, but you're worth it. I would say to the listeners, get the health that you deserve, get the smile that you deserve.
Incredible, incredible. Thank you so much for your time today, Fern. It's been incredible.
Pleasure. Such a pleasure.
How can people find you?
Yeah, our clinic is in Port Melbourne, Beacon Cove Dental Group, and I have an amazing team there with me as well. And then you can jump online and look us up there, beaconcovedental.com.au. And then we are also on the Insta, and my stuff is on the Insta as well, Dr. Fern White.
Amazing. Thank you, Fern.
Thanks, Shami.
Remember that this is general advice only. Please see your healthcare professional for more information. So what's your take-home message today? Remember, it's all about progress and not perfection. And are you suffering from stress? Visit the Usawa Learning Hub on usawa.com.au for more resources on how to de-stress, re-energize, and reclaim your health. Enjoy the journey.